Mr. Speaker, first, let me thank the gentlewoman from California, my colleague, Mrs. Capps, for yielding me the time. As a former nurse, Congresswoman Capps understands very, very well what people with multiple sclerosis must go through. I appreciate her work in managing this resolution, and I thank her for her advocacy on behalf of people with MS and for working to ensure that everyone has access to quality, affordable health care in America. Thank you, Congresswoman Capps. I also want to thank my colleagues, Congressman Russ Carnahan and Congressman Michael Burgess, the co-chairs of the Multiple Sclerosis Caucus in the House, for working with me on this resolution and for keeping the Congress focused on MS issues. This is really a bipartisan issue, and I appreciate both of my colleagues for working together to make sure that it stays that way. I also have to thank the over 110 co-sponsors who joined with us to champion MS Awareness Week and who made the consideration of this resolution today possible on the suspension calendar. In particular, I want to thank Chairman Henry Waxman and Ranking Member Joe Barton and their staffs for agreeing to bring this resolution straight to the floor, and of course to Crystal Santos on my staff, who understands this issue very well and has shepherded us through this process. Mr. Speaker, I'd be remiss if I didn't mention the work also of the Multiple Sclerosis Coalition, and in particular the National MS Society and its staff, especially Sean O'Neill, for leading the charge to create MS Awareness Week and for helping us with this resolution. And of course, I have to thank all of those who are living and suffering with multiple sclerosis and all of the friends and family and loved ones who care for them and take care of them when they are in need. This resolution is about commending you as well. And let me just say, I have to thank my dear sister Mildred for teaching me what it's like to live with multiple sclerosis. Now, Mr. Speaker, Congresswoman Capps, I called my sister and I talked to her before I was going to share her story to make sure that she didn't have a problem with any privacy issues. And she said to me, she said, Barbara, if there's anything you can do to raise awareness about the condition that not only myself have, but many, many, many Americans, then just do it and share what I have to tell you. And so this is her story coming from my sister Mildred. She said to me, she said, you know, it's so frustrating to go to the doctor and for the doctor and for me to ask a doctor a question about the symptoms of my disease and the doctor say, I just don't know. She said at first she thought the doctors were just putting her off, but come to find out the doctors just don't know. So this bill is for all of the times that, and she told me, she gets up in the morning, and this is very typical of MS patients, gets up in the morning and wonders whether she'll be able to walk that day. And let me just say, for all of the times that she's in remission, dreading the next flare-up, she said to me that every day she wonders what's going to trigger the return of her symptoms. And, Mr. Speaker, she also said to me that it's very important that we raise awareness about MS and that we do more outreach and more public education, more research, and really provide for more care for MS patients and more supportive services. And I have to tell you, my sister, I believe she was diagnosed when she was about 26 or 27. Now, she didn't tell me I could tell her age, so I won't do that, but she's a year younger than I am, and 2 years ago, I celebrated the 21st anniversary of my 39th birthday, so you can figure that out. She's been living a productive and fruitful life, and she has learned about the treatments and medications, and fortunately, she's had access to some of the best. And she wants everybody to have access to the type of treatments that she has had, but she also recognizes that there may or may not be a cure during her lifetime, and that this Multiple Sclerosis Awareness Week really is, and we've designated it from March 2nd to March 8th, is really the beginning of this effort. And so for that, she is deeply grateful, like I know that all MS patients are throughout the country. Some people may not know what multiple sclerosis is, so let me just explain a little bit about it, because this resolution is about raising awareness. MS is a chronic, unpredictable disease of the central nervous system. It's thought to be an autoimmune disorder where the immune system incorrectly attacks healthy nerve fibers of the central nervous system, interfering with transmission nerves signals throughout the body. People with MS can experience a range of symptoms that can either have permanent or intermittent damage depending on the type of MS that they have. These symptoms can include blurred vision, loss of balance, poor coordination, slurred speech, tremors, numbness, extreme fatigue, problems with memory and concentration, paralysis, blindness, and more. Most people are diagnosed with MS between the ages of 20 to 50, just as my sister was. Though there's no actual diagnostic laboratory test for multiple sclerosis, I remember my sister was diagnosed by the process of elimination, given all of the tests that were available then. Given the range of symptoms that occur, it's also quite common for someone to be misdiagnosed, and typically it can take about 10 years to receive a correct diagnosis. There are over 400,000 people throughout the United States suffering from MS, and worldwide over 2.5 million cases have been diagnosed. But the real numbers of people living with MS are almost certainly higher. Although MS is largely characterized as a disease that affects Caucasian populations, it does occur among African Americans and other minority groups and can be quite severe. And as my sister said, it's a disease that really does need to come out of the closet for people of color. Though because people of color tend to access the healthcare system less frequently, they may not get diagnosed at the rates that they should. And let me just say, our First Lady, Michelle Obama, her dad, Mr. Fraser Robinson, had multiple sclerosis. And so our First Family clearly understands the need for this awareness and for outreach efforts and for more resources put forth toward really finding the cause and cure of MS. The causes of MS are unknown, though there are an unusually high number of cases of MS among Gulf War veterans. There's no cure for the disease. So the resolution that we are considering today will support the work of the Multiple Sclerosis Coalition in raising awareness about MS by urging state, localities, and the media to participate in MS Awareness Week. And also, we're pleased that the Defense Appropriation Bill included $5 million to fund research into multiple sclerosis among our veterans. So I look forward to working with Chairman Obey and Chairman Murtha to ensure that these funds are well used. Again, let me thank all of my colleagues for their support. It's very timely and urgent that we consider this. And on behalf of my sister Mildred, who lives in Las Vegas, Nevada, and all of those individuals throughout the country with MS, let me just thank you so much for your leadership and for this resolution.
Gentle Lady.